name is Lillian Best. I'm from Liberia, and I'm the Secretary to the Board of Governors of the Central Bank of Liberia and a Fellow of the International Finance Corporation Milken Institute Capital Markets Program. I'm here today, and I'm pleased to welcome Dr. Vera Songwe, who joins us to share her insights on the COVID-19 crisis from Africa's perspective. Dr. Songwe, you are a Cameroonian economist now serving as the Executive Secretary of the United Nations Economic Commission for Africa, a role you've held since August 2017, based in Addis Ababa, Ethiopia. And my first question to you, you've contributed extensively to the discourse on the African Continental Free Trade Agreement, AfCFTA for short, including your views on what next steps the continent needs to take to seal that agreement as a catalyst for major growth. With that drive being overtaken by COVID-19, what are the priorities now in terms of leveraging AfCFTA to facilitate the reopening of Africa's economies and the recovery post-COVID-19?
Thank you again. Thanks, Lillian. Thanks to the Milken Institute for having me on this call today. Again, I think what we want to maybe remember as we think about the COVID-19 and what are the things that we can do for exit. There are three things we want to think about. The first one is that this is a global pandemic. And as a global pandemic, it has also affected, I think, the continent. First of all, economically, I think for many countries, there's been first the health hit and then the economic hit. On the continent, it's been the economic hit before the health hit. And that's why the AfCFTA, the African Continental Free Trade Area Agreement, is an important element of the solution for three reasons. One, it's a trade agreement, and the only way we know how to actually regrow economies is through trade. So the CFTA is going to be an important element of the architecture for building back and getting out of this crisis. But before we do that, your question about how do we exit, I don't think that we can really and seriously exit the crisis if we have not yet gotten up to speed on tracing and testing and isolating and ensuring that we have the right strategies for bringing down the numbers. And again, to do that, one of the things that we're working on is making sure that on the continent, we can actually trade goods across the continent in a way that is seamless. One of the things that we have seen during this crisis is the resilience of our private sector. From Tunisia to South Africa to Morocco to Senegal, we see the private sector developing test kits, developing PPEs, and the Continental Free Trade Area Agreement is the architecture for ensuring that these goods can travel across the continent. So we can create jobs in one part of the continent, but also supply much needed goods across the continent. The third thing about the CFTA is Africa comes together to trade with the rest of the world. When the COVID crisis hit, 54 countries closed their borders to particularly food and health goods. I think when Africa says, if you close your border to all of us, it's much easier for those countries to reopen, and we've seen that with India already. So I think the CFTA also gives Africa the kind of scale that it needs for negotiating capacity.
Going forward, post-crisis, you've talked in the past about it, and you've written about what the priorities are for African countries to really implement AfCFTA. And that comes in, even in the best of times, with some trade-offs in terms of, lowering fees and sort of foregoing immediate revenue generation for future gains. In a time when Africa is especially more constrained financially, how do policymakers square that circle and really make those tough decisions about how to manage this crisis?
The question when we come out of this crisis, or as we come out of it, I think we will come out of it, and hopefully soon, will be how can we create jobs? How can we get our economies back open again? And how can we begin to create more value for people? Ensure that, we don't let more people fall deeper into poverty than already have. And again, when you look at the CFTA today, before actually we got into the crisis, the Economic Commission for Africa had done a study on pharmaceutical products. Actually, the health sector overall, it was just fortuitous that we worked on health. We didn't know that COVID was coming, but $14.9 billion is spent importing health drugs from outside the continent. And what we were trying to do with the study, following up on that study, was essentially to say, can we produce at least some portion of those drugs on the continent? Can we create jobs? And that led to an initiative that we call the Pool Procurement Initiative, which was essentially looking at how can we then cluster sub-regions or countries and then begin to see whether we can do mass production. Because before you do that kind of production or those kinds of agreements, you need some off-taker agreements that are put in place. So we were actually working on that. The idea was that $14.9 billion was equivalent to 6 million jobs. So our argument was we're exporting 6 million jobs or importing 6 million jobs from outside the continent when we need to create jobs on the continent. Could we at least create 3 million jobs on the continent in the pharmaceutical sector using the CFTA? And the reason being that, you know, if we could then make sure that all the pharmaceutical products that we produce on the continent could move across and could be traded in each sub-region, then we were getting what we wanted. So this is, I think, a very clear issue that governments will have to think about as they get out. Now linked to that is the whole idea of technology and ICT. One of the big issues around the drug production is actually the reliability or the sort of counterfeit drugs in the system. Actually, to fight the counterfeit drugs in the system, what we really need is technology. We can, you know, you can sort of follow the barcodes and work more effectively. So as we get out of this crisis, again, we have seen even for the testing, tracing, isolating, and treating patients that we need a very sophisticated and very good ICT system in place. Today on the continent, less than 20% have access to the internet. Less than 15% can actually afford it, even if they have access to it. So we're going to be able to, we are going to need to, one, reduce the prices for ICT, increase access, and ensure that you have broadband stability so that more people can use it. I think that's the second thing. Finally, infrastructure. You know, our institutions first is a big part of the infrastructure we need to build. We've seen the weaknesses in our health institutions. We need to fix that. Infrastructure in the energy sector, we're going to have to do much, much better at. And then overall governance, we're going to have to do a lot better at governance as we get out of this governance by improving private sector businesses, improving the environment. You know this very well, Lillian. We are not going to get business back. We need FDI to come back in. And the only way that we can do that is by increasing the transparency of the use of government resources as we get out of this crisis. So people can trust again in the credibility of our governments and reinvest in them in a way that then all these things that I have said, creating jobs means taxes. You know, if those jobs are legal and are formal jobs, you get taxes created. One of the fastest growing sectors today, even inside the crisis, actually because of the crisis, is this medium we're using, technology, right? And so a lot of the taxes that are going to be created these days are going to come from the technology and the services sector. Africa, 51% of Africa's GDP was already the service sector. We need to do that well. We need to do that better. And then, of course, infrastructure as an enabling environment for that.
In the context of the G20 Africa partnership, in the context of ongoing talks with the IMF for debt relief for poorer countries, what could the global community be doing better? What is it doing well, and what could it be doing better to support Africa's fight against the pandemic?
There's a lot that's good that's happening already. I think that we're already very grateful and thankful for the World Bank and the IMF and the G20 Debt Sustainability Service Initiative that essentially are all sort of saying, you know, we need to give more liquidity to Africa so that Africa can respond to this health and then economic crisis. So I think there has been a coming together of the international community. I think we still need a stronger coming together on the health side. There's still a lot of debate about who gets the vaccine, who doesn't get the vaccine. I mentioned earlier in the context of the discussions on trade, the fact that countries were closing their borders to exports of both health but also food products. I think we need a little bit more global solidarity, a little bit more multilateralism in how we're going to work around some of those issues that need to be done. But Africa itself, I think first starting with the African Union under the leadership of President Cyril Ramaphosa, has come together. The presidents meet quite often to discuss what are the ways in which they can work together to come out of this crisis. I think we have seen companies, Ethiopian Airlines, for example, serving the rest of the continent, distributing pharmaceutical products. We have seen, yesterday was Africa Day, artists from across the continent coming together to sort of see how they can collectively and collaboratively work. Another thing that I think has come out of this crisis is the innovation on the continent, countries doing PPEs. I think that solidarity, collaboration, and innovation, businesses deciding to repurpose their factories to produce what was needed in the countries in which they are in, and then eventually for exports, I think has been fascinating. The innovation that we see in Senegal with these young kids doing new toolkits, or in Morocco, or in South Africa with ventilators, I think just demonstrates the resilience, but also the innovation and also the can-do spirit of the continent. Now we need, again, at the end of the day, to be able to find the financing that is required in the right format. And I think there we're still, many countries have given themselves stimuluses of 10, 20% of GDP. Africa is asking for $100 billion of a fiscal stimulus and the release of some special drawing rights for the private sector to ensure that both on the fiscal side, but also on the private sector business side, foreign exchange access, we can have some room to be able to respond to the crisis. And there, I think we're still sort of struggling to get out of that conversation. And I think that we must come together and say that, Africa, like any other continent in the world, requires immediate and urgent action. We cannot take too long to see how we react to this. Otherwise, I think the consequences, again, if one of us has it, all of us have it. So there is no way of saying that we're going to help part of the continent and not help the other. So as the Economic Commission for Africa, we're calling for support for all of the African countries to provide some additional liquidity so that they can continue to respond as effectively as they have done to the crisis.
Dr. Vera Songwe, thank you for your insights. Thank you for your time. Happy belated Africa Day. And please stay safe.
Thank you, you too. Thank you very much.